A warm welcome to all our viewers to our series Natural Medicine. I often hear sentences like, everything hurts, and nobody can help me, nobody knows why. But the pain is there, it is real, and bothers many people in their lives. With all the consequences that come with it, I'd like to share this topic with Professor Thomas Rau. A professor who shaped me very much, who for over 30 years, no, I've known him personally for 20 years and he's been a doctor for 40 years, and I'm really excited to see how successful he can work in such situations to help people recover. Stay tuned. Professor Thomas Rau, a warm welcome to the studio. You've probably heard this sentence before. And how did you then manage to find a solution to the problem? Very easily. You could have different titles. Everything Hurts and Nobody Knows Why is such a classic. I'm not recognized in my complaints. You've examined everything, and you don't know what it is. Why don't you know what it is? Because the search was wrong or not deep enough, not cellular or not metabolic. I was educated in rheumatology myself and had such patience all the time. A very short story. I was allowed to attend a huge congress in South Korea. They are way ahead of us in holistic medicine and the techniques above all. I was allowed to give a speech at a large medical congress, and before me was the president of the medical society. I've never talked to him before, and he said, the biggest problem in today's medicine in all Western countries, all civilized countries, and that also causes the biggest costs, are undetectable diseases. Or unknown, so unclear diseases. These pain syndromes are among them, for example, or the unclear neurological or the unclear cardiological diseses. Why are they unclear? Because academic medicine has, so far, addressed this issue incorrectly. These are cellular changes to the human system. We really have to think differently. Well, that's such a slogan. Whoever acts differently has to think differently. I act differently, I think differently. I think pathophysiological, I think biochemical. What happens where the pain is? At the nerve endings, at these small nerve fibers. That's where the pain takes place. Why? What is there? There's something inflammatory, something irritating that stimulates these nerve cells. And then they come to the head and you're in pain. A systemic problem. And this systemic problem, which is now expressed most in the nerve fibers, so that you get pain, the diagnosis is called fibromyalgia. But academic medicine doesn't know at all what fibromyalgia is. Then you have a beautiful stamp on your forehead, fibromyalgia. But what do? Painkillers are given? Cortisone? Yeah. No, if you try to identify the cause, we do cause medicine, cause treatment. And when you do that, then you have to ask yourself, what irritates these nerve fibers? They could be toxins, for example. There's aluminium, there's arsenic, there's mercury. Those are irritating, have a depolarizing effect on the small nerve endings. For example, there are wrong fatty acids, arachidonic acid, lipoic acid, and palmitic acid, just as an example. You can test that. Doesn't even cost a lot at Unilab or any other laboratory. Any doctor can test it, but nobody tests it. Nobody does it. I work very closely with the Toxicological Institute in Basel. Professor Krüslin, who is in charge of that, he's a A comrade of mine. I've known him since university. Hey, you, what you found in my patient is amazing. What kind of toxic loads they have? What do the rheumatological clinics find? Thomas, you are the only one in Switzerland who tests like this. So, who is scientific? So, we then try with these causes, or you can see something else, pathophysiological. You just have to think logically. Biological medicine is about the bios, the living, and it's logical, biological. And so I think biologically, logically. It could be that the depolarization character or of the nerve endings that depolarize, that they are a stimulus further. The acetylcholine is then released. It could be that they are lowering the threshold. Why is the threshold lowered? Because they've too little vitamin B, for example, because they don't have enough good stabilizing fatty acids, such as alpha-lipoic acids, all substances that should be present in the body, but are too little due to our diet, for example. If you start here, really at the cellular basis, that's what you call toxicological medicine. It may also be called orthomolecular medicine. It doesn't matter how you call it, but it's about that one really attacks cellularly, not simply suppressing the inflammatory process. That's just an expression. No, eliminate the cause. And then it works for some time. When I deacidify the body, when I give the body minerals and trace elements that it lacks, when I free the body of the wrong fatty acids that get into the body through nonsensical diet, for example, dairy products, which are irritating to the nerve cells, if I remove that, the level changes. And the body no longer has this sensation of depolarization of the nerve cells. It's really a logical approach. And this is how we go there. And there we have diagnostic methods. We have therapeutic methods. The therapeutic ones, this is completely analytical. The therapeutic methods, that is minerals, trace elements, vitamins. We have to bind, discharge, detoxify harmful substances that can be irritating, such as aluminium and arsenic. Yeah, we test every person. We all get these chronic, unclear problem patients. We test heavy metals on everyone. They are people from the street too. You don't believe what we find in toxicological research today. These people who are really soaked with the wrong stuff, from nutrition in particular, or from medication. Who doesn't have it? So, now back to Everything Hurts. Who doesn't have cholesterol-lowering drugs today? Devil's element. Who doesn't have that? Basically, nobody older than 50. But it is known in women over 45. If they have been on cholesterol-lowering drugs for 2 years, this is just one example now, then about 30% get fibromyalgia. The most common cause is cholesterol-lowering drugs. Then you have to remove them. You don't need them because our medication and our diet will lower your cholesterol anyway. They don't even need the drugs. So now that's an example. But we also have to detoxify people. This is what we do. Why am I so successful? Because I am strict, because I think and act logically, and because I include the patient. If they don't change their diet, and they constantly take in this lipoic acid, for example, or what do I know, this aluminium, then there is no point. I have a waiting list of patients. I want to treat those who participate, because in the end, the patients treat themselves. Strictness and persistence, a very straight line. then it'll be fine. I think I have 37 questions. On the one hand, let's start. Don't you get so angry when you see people and patients suffering for decades? And it never occurs to anyone to change their diet. It does not occur to anyone to detoxify a person. There's no poisoning, or there is no hyperacidity in academic medicine, I think. I believe it's an electrolyte deficiency, so how do you deal with that? I'm not the kind of person who gets angry. I don't fall into resignation and grief. I fall in joy that there is another way. And I can convey this fundamentally, different attitude, to people. I have a solution for you, my dear patient. You are my partner now, and I am your partner, and we'll do that together. I have the knowledge, you have the will to do this. If you don't, then go somewhere else. And that fills me with great pleasure that I have a solution. And I do that too. I train doctors. I've been doing courses all over the world for around 20 years. And over 500 doctors have attended my courses worldwide. And they do that too. It's wonderful. If you just watch TV. Sorry, you're a TV person too. I mean, the others. And if you just succumb to the propaganda information of the pharmaceutical industry and so on, and then actually still believe it, then I can't help you anymore. Somehow, they manage to ensure that everything that is said by the pharmaceuticals is law for us, without actually ever questioning whether the interest is really that all people are healthy, whether you are really interested in treating the cause of a disease or just the effects. That's no longer questioned today. You are strict. You look for the causes and treat there. And then the effect is gone. Completely logical. Everything I've heard now is completely logical, biological. Yeah, and yet it's sad that so few people still benefit from biological medicine. That's really sad. And that is a big task for us, that we carry that out to the outside world. I think if our medicine was brought into the university, like you said, then it would probably flatten out. This is my fear. I got the title of professor from Vienna myself. But I don't think I have my duties at university. This is a different mindset that we have, that our patients have, that another world of thought that we have, namely, that doesn't really work with today's very pharmacologically oriented guidelines medicine. I never, or basically never, do guideline medicine. Guidelines is, for me, something that shouldn't really exist. Of course, it's nice when there are theoretical guidelines. You can simply give the guidelines to any idiot. The black or white paper that every resident has in their pocket is fine. But actually, the patients don't fit in. And my patients, they don't fit into this Gaussian curve of the guidelines because they are somehow elsewhere. And that's why they could not be captured by medicine. I recently looked what the worst pandemics of all time were. And always number one, every year, is hunger. And the second is actually what happens every year that people suffer sickness from malnutrition. Be it cardinal diseases, be it diabetes and so on, a huge crowd. And exactly in these big stories where nobody looks, where we would have problem-free solutions, nothing happens. Nothing at all, unless you are seriously ill and are lucky enough to meet Thomas Rau or come to his clinic in Sonnenberg. where one can then experience this medicine. But I still somehow have the urge to want to change the world through these programs, for example. That you simply make it clear to people that nutrition, the right nutrition, is actually the key to a healthy, long, fulfilling life. And somehow we just don't get any further. Yeah, so that's a statement. There is no question, because it is out of the question at all that what you're saying is true. With a change in diet, humans can significantly change and improve health. Not just for coronary heart disease, no, in their minds too, in their whole feeling, also in their energy. So, with the right diet, you simply feel better. I have a lot of patients who tell me they came because of some chronic illness. I have a lot of neurological, rheumatological patients, or even cancer diseases. They come to me afterwards and say, actually, I don't need you anymore. Thank God. Thank God they don't need me anymore. Why? Because they're taking these drugs now. They're all biological remedies. And they changed their diet. They live differently. Their whole thinking has changed. But everyone who no longer needs me brings me 10 others. There's nothing like cured patients, because they bring the new ones. That's why I have a worldwide audience. I'd like to briefly dive into this poisoning problem again, because you always do toxicological tests. To what extent is it already today a topic for healthy people, for healthy viewers at home, to deal with a constant detoxification? That is the be-all and end-all. You have to constantly cleanse yourself of today's pollution that we have from our environment and through our diet. Humans have purification processes by nature. People have eaten something bad in the past as well, and had toxic loads or whatnot. Or they ate spoiled food that was also toxic, and they could detoxify it again. Unfortunately, our metabolic processes, metabolic pathways today, are just a lot worse. They are really blocked. In biological medicine, we always talk about the blockages. The blockages that come about through toxic exposure, through electromagnetic exposure, and through wrong nutrition. And we have to detoxify ourselves a lot more today than we had to do 40 or 50 years ago. The toxic loads have increased massively. For example, we do toxicological tests on every patient, heavy metals, toxic metals, but also toxic organic substances such as bisphenol and pyrethroids, and all these substances from nutrition, from the textile industry, from God knows where. And we hardly find a person who is not significantly burdened. But I've been doing this for 20 years, and it used to be less. We had other toxic exposures too, but in terms of quantity, we're now somewhere completely different. And today we have to detoxify. There are very simple ways. I would like to nutritional options, including simple remedies, such as selenium, vitamin C, zinc, zeolite, algae preparations and so on, which can be used. An active chelation therapy, for example, for healthy people, would that be something that should be considered to be done? Absolutely, absolutely. Every 3 or 4 months, or depending on where you are, you can do it more often, that you make such a 2 or 3 week intensive detox with chelation therapy or with zeolite, or with algae therapy, or also with intestinal cleansing, or with a strict 3-week diet change. I'm also an FX Maya doctor. Oh, too! Yes, I am too. And 30? No, that was almost 40 years ago. I did this training, or at least I have adopted this way of thinking. And that was already known back then. People already knew back then that such a detox cure, as it was called, or FX Maya cure as an example, adds an incredible amount of good, even to chronically ill people. But even with healthy people should do that too. Well, I once had 4 amalgam fillings for a long time. At some point I became aware that the amalgam should be taken out. Then I detoxified for years on the side with algae products. And then I actually did a blood analysis to see what is actually gone now. And these levels in the blood, they were catastrophic. I can believe it. And I still resent the dentist for that today. That a dentist is not actively advising the patient. After the removal of the amalgam of chelation drainage, because they can't get it out. The stuff is in there, and that has to be discharged. And maybe also an appeal from your side to the audience is needed. If they had amalgam fillings, that then really a chelation therapy would have to be made. Would you agree? For anyone who has amalgam fillings, I 100% agree. Whether you do that with chelation, that's a defined method. Whether or not you do that with chelation therapy is another question. It's good too, but first of all, amalgam does not belong in the mouth. And if you have it in, then you have to remove it. That's out of the question. No discussion. Before you can treat a patient, you have to get that crap out, right? Yeah, not exactly before, but I suggest that they remove the amalgam fillings. Remove them professionally. Not like you, obviously, where you just drill it out, and when drilling out a lot more is released and swallowed and so on. That's a problem. You have to do it right. And they have to remove that. That already frees a great toxic load, because a large part of the toxic load still comes from dental materials today. That's why I have a dentist that I work with, but a holistic one, and if you do that, then you have to drain. It is said that draining something is a term used in our medicine which means detoxifying. You can do that specifically. You can test, do you only have mercury or do you also have tin? Do you also have silver or do you have copper? Do you have cadmium and so on, or lead? You can test everything, it's very easy. Inexplicably, it is simply not tested. And then you have to drain that. You can use infusions, you can use algae, you can use zeolite. It can be done with different things. Vitamin C, zinc and so on, but not doing anything is completely dubious. And if a dentist still tells you today that these amalgam fillings don't do anything, it doesn't matter, then you have the wrong dentist. In fact, it is still preached like that. It is harmless. This lobby is insanely strong. It's not such a lobby, that's an ignorance. We follow the commitment that we continue education, but it is not followed. They have at some point passed their state examination and maybe did nothing since then. That's not just serious. Anyone who still says today that amalgam does not matter, that means they tell you mercury doesn't harm you. Such nonsense. It's highly toxic. People tell me that this is no longer done today. That's not true at all. In Germany, mercury is paid for by the health insurance. And if you want something else, you have to pay for it yourself. That's the facts, right? Still. What I also had a lot was aluminium, glyphosate. And then you get a little into studying and thinking, that shouldn't be in the body at all. It has nothing to do with this biologically. Yeah, I know, a conspiratorial topic. Let's leave it, but it's there. That keeps coming back. I am confronted daily with this subliminal accusation attitude that is justified, but it is not energetically correct. We know more today because we are educated. You have biologically trained doctors and practitioners who are simply further ahead than the less trained. And that brings an obligation. I bring this knowledge in circulation as far as I can. Of course, if I speak to Professor Krislin from the Tox Center of this institute in Allschwil, then he says, it's amazing how much the aluminium exposure has increased in the average patient. It's unbelievable what levels of arsenic we can find today. He's been in business for 30 years. He didn't have that 20 years ago. Quite different, but we had other things too. For example, there was Dr. Blumer in Netztal. You have to research that. Unfortunately, he died. 30 years ago, he worked with industrial workers in the Netztal. That's in Switzerland, where there was metal industry and textile industry. At that time, they did not have the knowledge in these factories. The people were heavily exposed to heavy metals or toxic metals, and they died, had neurological problems at that time. The Alzheimer's issue, even back then, he just detoxified them. And with the detoxified, these are very simple workers. He has had much better long-term results. The people had not completely lost their minds after retirement. They were not cancerous in high percentages. Just because he simply detoxified people in his study over 20 years. Incredible results. And this just goes away, this information. It's forgotten. That is sad and a shame. But let's summarize. Recommendation for all people may be to really do an examination in the area of poisoning problems. And if you can see in the laboratory report in black and white what is in there that does not belong in there, you can remove it or have it removed, because that's good for your health and plays a very crucial role. There's still something very important to come. We are really very scientific, and now someone comes along and I'll tell them, you have these mercury levels, these amalgam levels, it's in your body. We test the urine, we test the blood. It's not just the mucous membrane of the mouth. No, it is in the body, so in the whole person. And they say, but my brother, he has a lot more fillings. And we're both around 60 and he's nothing at all. Yeah. But you do, you are sick, and you are probably sick because of it, or among other things. Now, it goes on. Perhaps one has a better way to detoxify than the other. I can test that too. We have genetic tests where we can see whether the glutathione transferase, the methylfolate transferase, these enzymes in humans are present or not. And if you just don't have this enzyme because you have a different layout genetically, then you can't detoxify at all. But then you have to detoxify much more intensely and continuously than your brother, who may not have this genetic profile. But we can test that. It doesn't even cost a lot. I don't understand why this is not routinely tested. In the neurological clinics, in the rheumatological clinics, in the MS clinics, because mercury leads to MS. Aluminium leads to cognitive decline, to dementia. As you can feel, I get emotional. because there is so much to do and it's so easy. We just do it, and that's why we have good results. We humans often only do something after the horse has bolted instead of practicing prevention. So this appeal has been very, very important right now for you in the Sonnenberg Clinic in Appenzell. It is the standard. There is always a check how these toxicological findings are in the patients. For example, to get back to the topic now, everything hurts and nobody can help me. Here is a reason, or here you can find a cause, and then act relatively quickly, but this pain stimulus eventually disappears. The so-called fibromyalgia. So this diagnosis is not my diagnosis. I hate this diagnosis because it is only one facet. But that is, everything hurts. When people come to me for treatment, you can count on getting better in 4 to 6 weeks, significantly better in 3 months, and being largely cured in 2 years. But not with pizza and with pasta. Instead, you have to change something, which of course is told and taught to you, so that you can really apply it at home and can implement it. Thank you very much, dear Professor Thomas Rau. And you too, dear viewers. You've also heard it very clearly. Everyone has the chance, the opportunity to get out of a disease trap. But you have to look at it holistically, look at it biologically, to work on the cause. And that gives me a lot of hope and joy to know that there are medical professionals out there who are offering this type of medicine to you. Or even like Professor Dr. Thomas Rau, who has already trained 500 other doctors. That's honourable, that's great, and that makes me happy. All the best, see you next time.